Hi, I'm Dr. Cindy Frederick, one of the pediatricians here at Pediatrics West. Today, I'm going to talk about cough and runny nose in your child. A small amount of clear drainage during the day is a normal part of the function of the nose. However, a runny nose that requires frequent blowing or wiping and interferes with the child's activities is not. A clear runny nose that lasts for weeks and may be accompanied by sneezing and cough but no fever may be due to allergies. Depending on the age of your child, this can easily be treated with over-the-counter antihistamines if it is bothersome. Drainage and congestion on one side of the nose might indicate a foreign body in the nose, especially if it is accompanied by a peculiar odor. Your child will need to be seen in the office if a nasal foreign body is of concern. By far the most common reason for your child to have a cough and runny nose is the common cold. The common cold is caused by a virus in the upper respiratory tract. Your child will probably have more colds than any other illness during childhood. In the first 2 years of life alone, most children will have 8 to 10 colds, especially if they are in daycare or there are older school-age children in the house, since these viruses easily pass from one child to another. The virus spreads when a person with the virus coughs, sneezes, or touches their nose and gets the virus on their hands. They then touch the hand of a healthy person who touches their own nose, and the virus starts growing in the healthy person's nose or throat. A cold can then develop with symptoms of runny nose, sneezing, a low fever of 101 to 102 degrees, especially at night, decreased appetite, sore throat, and cough, fussiness, and slightly swollen glands or lymph nodes in the neck. The runny nose will start out clear in color, then turn yellow and maybe even green during the first several days of the illness, then become clear again and dry up as the cold resolves. The typical cold will last less than 2 weeks, and the symptoms should go slowly away over that time. Unfortunately, there is no cure for the common cold. Since it is caused by a virus, antibiotics have no effect and will not make the symptoms go away any faster. The best thing you can do is make your child comfortable by letting them get plenty of rest and drinking extra amounts of liquids to stay well hydrated and keep the mucus thin. Using a cool mist humidifier in your child's room and salt water or saline nose drops will also help keep the liquid causing the nose to be stuffy thinner. In infants, you can suck out the extra saline drops with a rubber bulb syringe to help pull out clogged mucus. The fever may be treated with acetaminophen if your child is over 2 months of age, or ibuprofen if they are over 6 months of age and are drinking plenty of fluids. Do not give your child aspirin for the fever, as it has been linked with Rye syndrome, a rare, serious illness that affects the liver and brain. Always call your pediatrician if your child is under 3 months of age and has a fever over 100.4 degrees. Over-the-counter cough and cold medicine should not be given to infants and children under 4 years of age because of the risk of dangerous side effects. Several studies have shown that colds and cough products don't work in children under 6 years and can have potentially serious side effects. For children older than 1 year, honey has been found to help soothe the cough. If it is given at bedtime, make sure to brush your child's teeth after it is given. For children ages 4 and older, cough drops or lozenges are helpful if given according to package directions. Mentholated rubs can be used on children 2 years and older. Rub a layer on top of the skin on the chest and front of the neck, and the body's warmth will help the medication go into the air slowly over time. The child breathes in this air, which helps to soothe the cough so he can sleep. Cold symptoms usually peak in severity in the first 3 to 5 days, then improve and disappear over the next 7 to 10 days. Older children usually don't need to see a doctor unless they look very ill. However, if your child is 3 months or younger, you should call the office at the first sign of illness, since it can be difficult to tell when young babies are very sick or maybe developing bronchiolitis, croup, or pneumonia. For a child older than 3 months, call for any signs of respiratory distress such as nasal flaring, where the opening of the nose gets larger with each breath, retractions, where the skin above or below the ribs sucks in with each breath, your child is breathing fast or having trouble breathing, or you notice the lips or nails turn blue. Your child will need to be seen by your pediatrician if there is a concern that secondary bacterial infection may have developed. Symptoms such as nasal mucus lasting more than 14 days, cough that lasts more than a week or seems to be getting worse, complaining of ear pain, or an infant pulling at their ears, fever over 102 degrees, especially if it does not respond to fever reducer or lasts more than 3 days, or your child is becoming much sleepier or fussier than normal. Remember, you can always call our office day or night to talk with a nurse if you have any questions or concerns about your child's symptoms or are unsure if he or she should be seen.